Good afternoon, and thank you all for being here with us today. I want to personally thank Dr. Dobbs and Director McCraney for joining us here today and for their dedication to ensure that we get past what is clearly the fourth wave of the pandemic, and particularly the Delta variant. Dr. Dobbs and Director McCraney, along with their teams, have been in constant communication over the last several months and year and a half now, and they have been instrumental in their efforts in helping us combat COVID, and I am proud to serve alongside them. I'd also like to take this opportunity to say a particular thank you to the men and women and all the folks at the Department of Health, the Mississippi Emergency Management Agency, and the Mississippi National Guard for going above and beyond in their efforts to make the vaccination process run as smoothly and as efficiently as humanly possible. At this time, I'd like to provide a few updates on several areas of Mississippi's COVID-19 response. As I have said repeatedly over the last several days, this current wave seems more and more to be a pandemic of the unvaccinated. I saw it written earlier today, and it went a step further. When you look across the country, to a certain extent, this current wave is the pandemic of the unvaccinated in areas of the country where it's extremely hot and where people have gone inside. We are headed towards a new peak, and there are a number of challenges that lie ahead. However, we must continue to focus, and we must continue to remain calm, moving forward with logic, with reason, and by following the data. I ask all Mississippians to do the same. We will get through this new onslaught of COVID just as we have gotten through the three previous waves. But we all must work together and do our part so that we can get back to some semblance of normalcy as soon as possible. The difference between this peak and our last peak is evident by the data. That difference lies within those who are vaccinated versus those who are not. I want to be clear. I've been vaccinated. And if you're watching us on Facebook Live today, you probably got to watch me get vaccinated, thanks to the help of some of Dr. Dobbs' finest employees. My mom's been vaccinated. My dad's been vaccinated. My wife's been vaccinated. My grandmom has been vaccinated. I believe the vaccines are safe. I believe they are effective. And I believe that they are the best tool we have moving forward to beat the virus. I have and will continue to encourage my fellow Mississippians to consult with your doctor about the vaccine. I encourage each and every one of you to ask your doctor questions about how the vaccine applies to their unique situation and to make the best decision possible for themselves and their family. Now, we have seen a rather significant increase in total number of vaccinations over the last several weeks. Just 4 weeks ago, we had about 18,000 shots put in arms. Last week, we had almost 60,000 shots put in arms. And we are on pace this week of having over 70,000 shots in arms. In total, 1.3 million of our fellow Mississippians have been vaccinated, and an additional 400,000-ish Mississippians with some protection from this variant through natural antibodies. We continue to see more and more data, and the data is becoming more and more clear. Those who receive the vaccine are significantly less likely to contract the virus, and for those very few number of breakthrough cases, they are much less likely to spread the virus, and it is highly unlikely that if you have the vaccine that you end up in the hospital or that you end up in an ICU bed. Out of the total number of new COVID-19 cases in Mississippi that we are reporting, approximately 97% of those are found in unvaccinated individuals. Approximately 89% of our current hospitalizations are those who have not been vaccinated. 89% of the hospitalization are those who have not been vaccinated. The sooner individuals take the opportunity to get vaccinated, the more individuals that can get vaccinated, the sooner we can move beyond this peak and beyond this pandemic. I thanked some of the heroes in our state agencies that have worked throughout the last year and a half on this pandemic. We certainly have many, many healthcare heroes that I'd also like to thank. I'd also like to commend the teachers and the administrators in education for their willingness to adapt and to work with us to get our kids back in school and to keep them there. Our students are better because of the efforts being made by our teachers throughout the entire state during these challenging times. As I have said since this time last year, there is nothing more important than keeping our kids in the classroom. Throughout this pandemic, there have been risks associated with virtually both sides of every decision that we have made. There are certainly risks to some kids in the classroom. There's also significant risk to kids not being in the classroom. Our children need and deserve to continue to improve their educational attainment level. We accomplished this last year, and it was something that many other states struggled to do. But I believe we can accomplish it again. We were able to get our kids in the classroom last year due in large part to the flexibility that we've given local school districts. Our school boards and superintendents are our most local government officials in the state. They are uniquely positioned to deal with the rapidly evolving situation on the ground. I have entrusted those local school boards and school officials to determine the best way to ensure that our students are safe, that they are in the classroom, and that they are learning. As you are aware, I announced yesterday, in consultation with Director McCraney and Dr. Dobbs, that we would extend Mississippi's state of emergency for 30 more days. This will ease the process for securing the additional resources that we announced on Wednesday. It will allow our healthcare system to continue doing what is needed for patients, ensuring expanded access to telemedicine, and it will provide us with the flexibility to continue to utilize the Mississippi National Guard. My goal from the beginning has been to protect the integrity of our healthcare system, and that goal remains the same. It has never been a realistic goal to eradicate us from the virus. It's never been a realistic goal to see and ensure that no one in the state gets the virus. Our goal is to protect the system such that every single Mississippian that can get better with quality care receives that quality care. Yesterday, I had a very good phone call with FEMA Administrator Deanne Criswell, as well as Region 4 Administrator, someone with whom we work regularly, Gracia Check. I appreciate their support during this challenging time. In addition to our work with FEMA, we are working with the private sector and looking at contractual relationships to provide relief for many of the challenges we are facing. This week, Director McCraney and the Mississippi Emergency Management Agency advertised a request for quotes for the staffing of medical services. The deadline to submit those responses was noon today, and the team at MEMA is currently working as we speak to review the 19 responses that we received. To give you an idea of what we have requested, we have requested primarily staffing As I have said over the last week or two, our challenge, and Dr. Dobbs will certainly hit on this as well, our challenge is much less about the physical aspect of hospital beds or the physical aspect of ICU beds, and it's much more about actually staffing them. I had been advised that Mississippi hospitals have lost some 2,000 healthcare professionals, nurses, etc., within the last year. It is that staffing shortages that we are having to address. We have requested through this RFQ some 73 hospitals having input in this request. We requested 65 physicians, 920 nurses, 41 CRNAs, 59 advanced practice nurses, 34 physician assistants, 239 respiratory technicians, and 20 EMT paramedics. I am informed that if this staffing level can be attained, it would secure and open up 771 med-surg beds and 235 ICU beds not currently staffed in the state. This obviously is a request for out-of-state resources. Anytime you are dealing with the federal government and the Stafford Act, there are processes that you must go through. You must first ensure that these resources are not available at the local level, then that they're not available at the state level. Then you have to go through the EMAC system to ensure that other states are unable or unwilling to provide those services. And it is at that point that you can go to the private sector and ask for a contractual relationship. So over the last several weeks, that is the process that we have been going through. As I mentioned, we're very pleased that some 19 contractors responded to that request, and we will be putting individuals on the ground, hopefully within 7 days, from one or multiple ones of these various vendors. In addition to the staffing shortage, we are taking the necessary measures to ensure that our hospitals have the resources that they need to care for this next surge of COVID patients. This morning, the Mississippi Emergency Management Agency did request an additional 150 ventilators from the national stockpile. We do have some ventilators available, and we have delivered, Mike will tell you, I think 13 total to one hospital system earlier today to address the challenges that that particular hospital faces, and we appreciate what they've done. In addition to this, and Dr. Dobbs will talk about these 10 teams, we have requested and received approval for additional ICU bed capacity at both the VA in Biloxi and the VA in Jackson. We've also submitted a request for 10 monoclonal therapy teams. The best way to address the challenges within our hospital system is to ensure that individuals don't get sick enough that they need a hospital bed. The first way you do that is through vaccinations. The second way you do that is through treatment once someone receives a positive test. The monoclonal antibodies have proven to be a very successful treatment that certainly reduces hospitalizations, and Dr. Dobbs will spend a great deal of time, I'm sure, addressing that. We do have some 40-plus centers of excellence that are currently utilizing that particular treatment, but we have requested from the federal government 10 additional teams to help with that. As we progress forward, we will continue to monitor the needs of our healthcare system, and we'll do everything in our power to meet those needs, working through the system as it exists. My entire team, the team at the Department of Health and the Mississippi Emergency Management Agency, have been working closely over the last several weeks as the number of cases have risen. We find ourselves today at or near our peak levels from the previous surges, in both hospitalizations as well as in ICU patients. We will continue to work together to mitigate this crisis, as we have done from the start of this pandemic. Myself, Dr. Dobbs, Executive Director McCraney, and our teams will work around the clock to ensure that these additional resources get to those individual hospitals in the same manner that we got literally millions and millions and millions of individual PPE to them during different phases of this particular pandemic. So with that, I'm going to turn it over to Dr. Dobbs and let him give an update. Thank you, Dr. Dobbs.
Thank you so much, Governor, and I would like to give you a special thanks for extending the state of emergency. That makes it so much easier and effective for us getting through this part of this phase of the pandemic. Additionally, for your ongoing support for vaccinations, not only for individuals, but also is our best way to get out of this pandemic. You know, as you guys know, we reported the largest number of COVID cases a day that we ever have. We reported 5,023 cases and 31 deaths today, 166 nursing home outbreaks. When we look at the deaths that we've had over the past 4 days, I want to do a little bit of a dive. We've lost 4 healthy people in their 20s, 2 of whom were pregnant, 0 vaccinated. If we look at those who were in their 30s in the past 4 days, we've lost 10 people in their 30s. And these aren't people who are chronically ill, cancer patients. These are normal people who were at work or a couple of weeks ago. 10 people in their 30s have died from COVID, 0 vaccinated. If we look at those in their 40s, we've had 12 die. 2 of those were vaccinated. And then if we look at those who are in their 50s to 60s, 50 to 60, 17 have died and 1 was vaccinated. I mean, there's a pattern here. We are seeing clearly vaccine breakthrough, but by and large, the vaccine's been incredibly protective and helpful, and especially for people who are under 50. People who are over 70, over 80, we are seeing more breakthrough deaths, but we're not all that surprised, as you've seen from our previous conversations. That leads me to a couple of other things that I do want to talk about. As you may be aware, FDA yesterday approved the use of additional doses of vaccine or booster doses for people in certain high-risk categories. Specifically, those are people who have weakened immune systems, people like who are on cancer chemotherapy, or maybe they're on immunosuppressive drugs for autoimmune disorders, or maybe transplant patients. The group of people who are likely to qualify, according to CDC's meeting today, are probably going to be very similar to the Health Alert Network message we sent out on July 23rd. But I do want to be very clear, this isn't a blanket booster recommendation. This is only for people who have clear, weakened immune systems. Expect to see more information going forward, but we really look forward to giving docs this guidance. They've been awaiting for additional clearance from FDA and CDC to start doing this more and more in their clinics. We still are going to recommend at this time that people in these groups still have that conversation with their doctor, but we're going to try to make more and more availability for these folks into the future. But right now it still needs to be a physician-patient conversation for the most part. So stay tuned. Specific details are on the way. The last thing I really want to sort of jump into is the monoclonal antibody treatment. That is such an effective way to keep out of the hospital and also to prevent death. We definitely want for folks to be vaccinated and to get protected. But, you know, everybody is not vaccinated. And if you get COVID, we want you to talk to your doctor about getting monoclonal antibodies. We've seen a multifold increase in our utilization. We have 40-plus centers of excellence around the state. We've requested 10 federal teams to come augment that effort, covering some of the geographic gaps we have within that sort of center of excellence network. And we also have a lot of other private clinics that are doing it. So we're going to try to maximize that resource. The long and short of it is, if you get COVID, the first thing you do is talk to your doctor about monoclonals, even if you don't feel that bad yet. You don't want to wait until you're so sick it's not going to work for you. And if you're someone who is vaccine hesitant and haven't made that jump yet, don't be antibody hesitant, right? If you get COVID, we don't want to be having the conversation as you're getting wheeled into the ICU saying, hey, doc, what can I do about it now? It's too late. The last thing I just want to mention in that same sort of vein, we know that of people who get COVID, diagnosed in Mississippi, about 2.2% of them will die. And if you have a lot of people with COVID, that's a lot of people who are going to die later on. About 15% of those who go in the hospital aren't going to make it out. About a third of those who go in the ICU are not going to make it out. And about 2/3 of those on life support are not going to make it out. So let's do the things beforehand that are going to keep that from happening. First of all, don't get COVID. Get vaccinated. Exercise these simple precautions that we know will prevent transmission. And number two, if you get COVID, your first call should be to your doctor, or we're also working on other mechanisms about getting monoclonal treatment. We're trying to make it more and more available because we want to keep you out of the hospital. We want to keep you alive and with your family. Delta surge isn't going to last forever. We just need to buckle down and do what we got to do to get through this together. Thanks, y'all. Oh, that's yours.
At this time, I'm going to call on Director McCraney to give us an update on the requests that have been made through the Emergency Management Agency and team. And I appreciate him and his team's efforts and work as they've been working around the clock to secure the additional resources that have been requested. Director.
Hey, good afternoon. Just to report out on what MEMA, and when I say that MEMA is doing something, it's really the team effort. It is all the state agencies which help and support us throughout this process when we've been activated. Currently, if you look at today, we are at day 524 of the COVID response, in which we've been a joint operational command with the Mississippi Department of Health. It's the longest one I've ever been involved in, but during that time, we also deal with tornadoes, hurricanes, and every other disaster that may happen statewide as well. So we have not lost any of our abilities to respond to those during this entire event. Currently, we have 60 plus days of stockpile in our State Emergency Logistical Operations Center, our warehouse, that might be needed around the state. To this date, we have issued over 62 million pieces of personal protection equipment to those hospitals, long-term care facilities, and other facilities out there that might need it. That relates to about 9,400 deliveries that we made throughout the state since this time. If you back that up and you go just since July 1, we're about almost 2 million pieces or items of PPE being distributed throughout the state, and about 380 of those we have delivered them to those entities to make that happen. We have also, the governor spoke about us receiving the 19 vendors. That was a quick turnaround, and it was great to see that the private sector came on board very quickly, had a lot of questions. We've got those answered, and we do have a joint team of the Department of Health and ourselves here at MEMA, and we're evaluating those, and we will get those on the street as quickly as possible. We've already spoken about all the different specialties that we asked for, whether it be a doctor, CRNA, registered nurses, etc. We've also requested those 150 of the ventilators, and they're on the way from the federal government. We've got that approved. We also have 2 DOT teams, Department of Defense, that are going to come out and help and assist with those shots. To include that, you have the Disaster Management Assistant teams, DMAT, that was at the hospital last night. Some of you might have seen that. They're here on a rotation, and we're ready to do a request to rotate in another team behind them if we need to extend those services. But I think what the private sector is going to be able to bring on board is the ability to get down into the individual hospitals and the specialties that they need to open up the current rooms that they have. Dr. Dobbs and I have discussed it, along with others, that we don't need to necessarily build a hospital in certain times. We need to fill the beds that we have. Everything that we have, the logistical issues are all right there. So we're looking very good for that. To caveat on Tropical Storm Fred, his impacts will be minimal for the state of Mississippi. We're going to have some winds, maybe 10 miles an hour, 15, 20. But we are looking at our states to the left of us and to the right, and we're all prepared. You've got to understand that the American Red Cross, all the things that we would prepare for a tropical event, we have done just the same way that we do it along with the COVID response. So this is a dual or triple mission that we have to do. The locals have stood up. The American Red Cross is ready to come. We have a plan for sheltering. Masks will be required at those shelters. We're not going to make it mandatory to be tested. You will not be turned away from a shelter if you go to a shelter in case you want to seek refuge during any tropical storm. This is hurricane season. We've got a long way to go. It will not be the 524 days that we're currently under COVID. This will pass, and we'll get back to Mississippi regular weather. The state has the budget and the monetary ability to handle anything that we see in the future for COVID. Every emergency starts local with the local hospitals, local emergency managers, those people that respond. If it overwhelms them, it comes to the state. The state, if I do not have the asset and I can't get it from, whether it be the Department of Health or whether it be another entity in the state, UMMC, they start getting, the plan has been written and it has always been there that we defer to the federal government, then they start outsourcing outside of the state to bring those in. If we were to mobilize the medical units or for the Mississippi National Guard, those members are currently working in the hospital setting, in a doctor setting. We would be trading a one nurse at one location to a nurse at another location. I didn't gain anything there. So we've taken everything into consideration. We've got a good plan going forward, very, very confident in where we're headed. And Governor, that's all I have to report on. Subject to any questions.
Governor, you keep talking about protecting the integrity of the health.
If you'll just wait a second,
Sorry.
yeah, that'd be great. Thank you. Look, the reality is that Dr. Dobbs, Director McCraney, and their entire teams have been working very, very hard to address the challenges that we find ourselves in. And the best way in which for us to get beyond this, the fourth wave of this COVID-19, is for all of us to come together, for us to work together, and do the little things to take care of ourselves and take care of our families. So with that, I'll start back there with you.
Thanks. You keep talking about protecting the integrity of the healthcare system. This week, leadership at UMMC warned that Mississippi was on track to hospital system failure, meaning full diversion of major hospitals. And that was before transmission ticked up from 3,000 to 5,000. Considering the velocity of this new wave, what else will you do to help slow transmission rather than trying to backfill capacity for overflowing hospitals?
You know, I think one of the points that you made that was very important is the fact that you know, when you look at when we get through the next week, 2 weeks, 3 weeks, however long it takes, and the data comes in, I think one of the things that we're gonna have to determine at that time is, as Dr. Dobbs mentioned, the number of individuals that are 30, 40, 50 in those categories that are struggling with the Delta variant. The question that I think is not yet answered is, does the Delta variant treat those individuals differently than the previous variants, or is it simply that there's such a higher percentage of individuals in those categories that are contracting the virus, that the percentages of those who have terrible outcomes is greater? And I don't think we know the answer to that yet. What I do know is when you look at people over the age of 65 in Mississippi, over 71%, I think 73% of those over the age of 65 have been vaccinated. And you look at those under the age of 40, let's just suffice it to say there's a lot less than 73% of individuals between the ages of 12 and 40 that have been vaccinated. And so we are certainly continuing to encourage our fellow Mississippians to take the necessary precautions. We're not going to have a statewide mask mandate. We're not going to have top-down statewide intervention at this time. If you believe, if you have not been vaccinated, I encourage you, if you're going to go out in public, I would encourage you to wear a mask. If you have been vaccinated. I believe that the vaccine works, and I don't personally think that extra layer of protection, but it is, to be fair, an extra layer of protection that may reduce the possibility of transmission by some amount. If that's what makes you feel most comfortable, then I'm all for you doing it. You know, one of the things that I've said from the beginning, and those of you who have sat through the literally hundreds and hundreds and hundreds of hours that we've had these press conferences over the last year and a half, I don't believe in mass shaming on either side. I don't believe that you ought to shame someone because they are wearing a mask because you don't believe in them. And I don't believe you ought to shame someone because they're not wearing a mask because you do believe in them. I believe every individual ought to make what they believe to be the best decision for themselves to protect themselves. And there is no doubt that in looking at the Delta variant, one of the things that does seem very clear now, and Dr. Dobbs may want to speak to this, it seems like the previous versions of the COVID-19, from the point at which you were actually connected to it, or the point at which you were exposed to it, to when you actually started getting symptoms was oftentimes 4 or 5 days. This Delta variant, number one, is highly transmissible, and it seems like symptoms actually start much earlier than that, and so they're starting within 2 days, and therefore, one of the reasons it's spreading so quickly, it seems to me, is because those individuals, once they get those symptoms after a day and a half or 2 days of having been exposed, then they then become contagious and expose other, mostly unvaccinated people to the virus. Did I get that right? Or? Okay, thank you. I'll come back to you in a second.
Governor,
Ross.
we've had 16,000 positive cases this week, and more than 100 people have died. Why not a statewide mask mandate?
Well, I think that the 1.3 million Mississippians who have chosen to get vaccinated, y'all have written a lot or talked a lot about my remarks a couple of weeks ago, I guess it was 15 days ago now, at the Neshoba County Fair, saying that I believe that personally, and everybody can have their own opinion, but I believe personally that the CDC and their ever-changing guidance on masks has been harmful, and I think when you're looking at trying to get additional Mississippians vaccinated, telling them that, yeah, we think you should get vaccinated, but whether you get vaccinated or not, you're still going to have to do all the same things, I think it tends to curb actual vaccinations. Similarly, when I think the CDC made what I'm sure was a well-intentioned decision, but when they decided to take J&J off the market, and they did it for 6 days, now I don't know what they figured out in 6 days, but they did it in 6 days because there was a negative reaction to 6 of the, at the time, about 6 million Americans who had gotten the J&J vaccine. I believe when they took that off the market, it significantly reduced the number of individuals who got vaccinated. I know it did. I know for a fact it did in the short run, because there were a lot of people lined up for the J&J vaccine. There were a lot of people, even on our own state site, that had an appointment to get the J&J vaccine. But when they put it off the market for 6 or 7 days, it not only curbed those individuals' willingness to get the J&J vaccine, I'm afraid it also, again, we're talking in terms of certain numbers, I think it really curtailed those individuals' willingness to get the vaccine. Because at that time, if you'll remember, and this was, and I don't remember exact date, let's call it March or April, at that time there were a lot of people who may or may not have believed in the vaccine, but they would have done anything just so they could go back to living their life the way they've always lived it. And they thought by getting the easiest path to that at the time was, the path of least resistance at that time was the J&J vaccine. I believe the CDC making that decision certainly curtailed Mississippians from getting the vaccine. And I think several of those decisions have led to us overall having less individuals vaccinated. You can follow up.
You didn't answer the question. I was simply asking about trying to prevent the massive spread of this highly contagious variant.
Well, Ross, actually I did answer the question. What I said, and I'll say it again, is I believe that if you are trying to encourage individuals to get vaccinated, that there should be some reward to having gotten vaccinated. What we have determined is that if you look at the total number of individuals that are getting the virus right now, 97% of those individuals are unvaccinated. 97%. What that tells me, now everybody needs to look at the data and make their own decision, but what that says to me is the vaccine works. The vaccine works. Now, adding a cloth mask on top of being vaccinated, does that take it from 99.93, 99.94% effective to 99.95 or 99.96? Maybe it does. Maybe it does. But the reality is, I believe that if you're vaccinated and that you have taken that particular decision, and let's be honest, okay? I know that some of you want to say, well, you know, this is an easy black or white decision that you either take it, you either believe in the vaccine and get vaccinated, or you don't. The reality is there are risks associated with taking the vaccine. There are risks associated with not taking the vaccine. There are risks associated with taking the vaccine. Now, I would submit to you the risk associated with being vaccinated is far less than the risk associated with being unvaccinated. But there are potential side effects. There are individuals in America, and we need to be honest with people. You see, we don't need to stand up here and preach at people about what, by golly, you ought to do or not do. We ought to be honest about the pluses and minuses, and the people of Mississippi can make a good and the right decision.
Governor, I have a question from a pediatrician in Hattiesburg who wants to know, given that children under a certain age cannot get vaccinated, elementary school age children primarily, some in middle school, what steps should the state take then? I know you said that decisions are best made at the local level with school boards, but would you consider some safety measures from the state level, particularly aimed at that age group that cannot get vaccinated even if their parents wanted them to?
Yeah, so I don't have any intention of issuing a statewide mask mandate for any category of Mississippians at this time. I don't know how I can say that differently other than the way I've said it repeatedly for a number of days and weeks and months. If you look at those individuals under the age of 12, what you find is that it is very rare that kids under the age of 12 have anything other than the sniffles. Does it happen from time to time? Sure it does. We have had, I believe, one fatality of an individual. Maybe it could have been two. I think there's 3 under the age of 18 at this time, 2.
4 so far, 1 this summer.
1 this summer, 1 during the Delta variant. And so for those under the age of 12 that are not currently eligible for the vaccine, it is highly unusual for there to be any significant effects. But for that individual parent who has a kid that they're worried about, or for the person for whom you're asking the question, if their kid is going to a school, I would recommend to them to go to their school district. And if they think the best thing to do is to make masks mandatory within that school district, then they have every right to do so. Also, if the school district either will or will not agree with the opinion of that particular individual, and he or she is worried about their kid that's under the age of 12 going to school, they certainly have the option of encouraging their kid to wear a mask in the classroom and protect themselves if they believe that will have a significant impact on protecting the kid in the classroom. I have confidence that the individual school districts around Mississippi are taking all of the local factors into account. I spoke with a school board member yesterday, in fact, that they were looking at ways in which to spread out students within the classroom. They were looking at the potential of mask requirements. They were looking at things like other things to keep kids in the classroom while these numbers are up high. And I think that certainly makes sense. So, yes, ma'am. I'm going to come back to you in just a minute. If you would not interrupt the others, it would be a lot easier for us to get through this. Thank you.
2 quick questions, Governor. Thank you. Adrian Broadus from CNN. 1, can you confirm that at least 4,400 students are still in quarantine?
I don't know the exact number. My guess is it's more than 4,400.
More than 4,400?
You know, we get those reports on a regular basis, so I'm certain it's more than 4,400 just because it's a cumulative thing. We'll put a new report out next week. Yeah.
And my other question was for the governor. You made it clear that you were vaccinated, your family's vaccinated. Are you hoping by sharing what your family has done, that will encourage others to get the shot?
Well, I'll tell you, and I want to just mention something that Dr. Dobbs just mentioned because I think this is important. My guess is there are more than 4,400 kids in Mississippi that are currently quarantined. I don't know the answer to that, again, because that was probably the report that the department put out earlier this week. But just as a reminder, if we have approximately 450,000 Mississippi kids in classrooms across the state, if there's 5,000 that are quarantined, that means there are 445,000 that are in the classroom learning. If there are 10,000 that are quarantined, that means there's 440,000 that are in the classroom learning. And so, you know, I think the biggest mistake, as we look back, and COVID-19 may never go away, I don't know. But I think as we look back 5 years from now on educational achievement across the country, those states and those few districts in Mississippi that didn't have kids in the classroom for the last year and a half, there were an awful lot of kids who are never going to recover from that. And that just truly breaks my heart. The other question, and it's a good question, it's a fair question, which is, by sharing the decision that I made, do I hope or do I think that that is going to lead others to get vaccinated? I'll be honest with you. Dr. Dobbs came to me in early January of this year and said, look, we know that there's vaccine hesitancy on all over the state. There's vaccine hesitancy all throughout the political divide. I hope that you will consider getting vaccinated. And I hope you'll be public about getting it. And I said, well, why don't we just do a Facebook Live and you get your best nurse to take a bad patient and I'll sit there on Facebook Live and get vaccinated. I did that in January. And so I'm hopeful that, that's helped over the last 6 months. But, you know, I know that there's a lot of opinions in this room and throughout the state about, well, if one person would just say more, if one person would just do more. I want y'all to think about these numbers for just a second. Currently in Mississippi, we have a little over 1.3 million Mississippians that have gotten vaccinated. In the 2019 gubernatorial election, we had approximately 850,000 Mississippians who voted. So right now, there are 450,000 people, at least, who have gotten vaccinated who hadn't voted. And so if you just assume that everyone who voted in that election have gotten vaccinated, what you're thinking here is people in our state that I couldn't even convince to come out and vote for me. I couldn't even make them so mad that they came out and voted against me in the elections are just going to automatically get vaccinated because I stand up here and say it. I'm clear, and I think the data has been clear and is becoming more and more clear, that the best way to protect yourself is through getting vaccinated. Nick, back to you.
So, you know, you're saying that you don't want to issue any of these statewide mask mandates or even the county level mask mandates that you did previously, but for schools particularly, rather than the severity of the cases, we're seeing entire schools shutting down because of mass transmission of COVID-19. Even in the earliest weeks, we're seeing much more transmission in schools, much more quarantines, and in fact, entire districts are having to go virtual. Didn't the mask mandate help keep kids in school last year, and can't it help keep them in school this year?
Well, you know, I'd love for you to go to the state of Louisiana where their governor issued a statewide mask mandate. Everyone in here's hair is on fire, and understandably so, because we had 5,015 cases reported today. The 7-day moving average in the state of Louisiana is almost 6,000. So they've had 42,000 cases in the last year, in the last week, and they had a statewide mask mandate in place the entire time. So here is the reality. What we say, what we write on the page, what we do doesn't matter a flip. What matters is how individuals act, what they choose to do. I would tell you, for a 14-year-old kid or a 16-year-old kid that is in a school that has gone and gotten double vaccinated, I don't think they ought to have to wear a mask in the classroom. I do not think they ought to have to wear a mask in the classroom. I think for kids under the age of 12, we saw last year that there was very little transmission, and we saw that when there was transmission, there was very rarely a significantly negative outcome. Very, very, very rare. And so while I appreciate the passion that you asked the question with, I had a 9-year-old who was in the classroom last year who tested positive for COVID. And so I know what it's like as a parent to deal with that. I know that these are challenging times. I also know that we have significant risk associated with every single decision that is out there. What's most important is that individual Mississippians recognize that this is a very transmissible disease, or transmissible virus, and that it is doing, and it can be long term. It can have serious consequences, and it can have serious consequences in the short term and the intermediate term as well. Jeff?
Yeah, today your messaging about vaccination appears pretty strong, maybe stronger in the past. You didn't mention choice or whatever. Has something changed in your mind as far as respecting people's choice? Or?
No. In fact, what your organization has been writing is a figment of your imagination as to what I have said. I have been consistent since the day I was on Facebook Live in January that I believe that the best course of action for individuals is to get vaccinated. But even though I believe that, Jeff, I don't even begin to think I'm so much smarter. Unlike some of you, I don't think I'm so much smarter than every other Mississippian that I ought to be telling them what to do. I tell them what I think is right, but I am going to forevermore defend their right to make the decision that is best for them and their family, period. Yes, sir.
Those private entities that he was looking at to contract with, what would be the length of time for those contracts, and how much of a dent do you expect the private sector to be able to make in this need for medical personnel right now?
Yeah, I'll just tell you the contracts are going to be, I'll let him tell you the details, but the contracts are going to be for as long as they need to be, and the dent that they're going to make with 19 bidders, I'm hopeful will be whatever is necessary. So, you've maybe seen some of the.
Yeah, I'll kind of make this comparison. Katrina, I still have contractors on the ground from Katrina in that storm, and whatever it takes to get this pandemic across the finish line, that's what we're going to do. There's no deadline on me. Our FEMA disaster number is 4528. You can go out there and look at it on the federal website, and the end date has not been put in stone yet. So we have a beginning date when it started, and we're going to run it all the way until we cross finish line and we're able to recoup those forces and bring them back. We'll keep those vendors on time. We'll advertise again when necessary if we have to continue to keep replacing those, because it's only so long that ICU nurse can stay on target for 7 days a week. Got to give them rest periods. So we've factored all of that in, and we're ready to go. There's no end.
Follow up on that, is the state paying all the expenses on these contracts, or is there federal money coming in?
Absolutely federal money on that.
Okay.
That 4528 is federally reimbursable at 100%. There's front money, of course. I'm going to get billed monthly or weekly from these companies, and we're going to front that. And we have a disaster trust fund that has been set up by the governor and the legislature, and that is well funded, and we're ready.
And so the hospitals themselves will not come into any more expenses because of this. The government's paying the tab for it.
That the government's paying the tab on these vendors when they're coming in to fulfill the contracts that we're letting out on this, yes. They might have other projects that they're working, but I don't know about those.
Follow-up question for either you or Dr. Dobbs. There was talk earlier this week about the state requesting a Navy ship. What is the status of that?
I'll answer that.
Yes, sir.
That request has been denied by the federal government. I spoke with the FEMA administrator about that yesterday, and the current FEMA administrator under the Biden administration was in New York City during the early stages of the pandemic. And what they determined is that they put very few patients, as in almost none, on that particular ship that was docked there in New York City. We've talked about it pretty regularly over the last week or two, and that particular ship is accustomed to being out in the middle of the ocean, and it is fantastic for what it is, but it is also very, very high, for instance. And so it's not real easy to get patients, for instance, onto and off of a ramp that goes like this. And so I think really the ask for the ship was as much about the over 500 personnel that come with it than it was about the actual physical facilities. I don't anticipate that the USS Comfort is going to come to Mississippi, although we would welcome any of the 550 healthcare professionals that are on that particular facility that the federal government would like to send us. And again, we're in a position in which we have a federal team here in Jackson now. We have another federal team that we anticipate will be in Tupelo by Sunday. We are working with another entity about potentially having a third team, potentially for Hattiesburg, potentially for the Jackson market, and we are going to backfill all of those because again, as Director McCraney has said, we're only going to get some of these federal teams for a short period of time. And so it's to fill the gap until we can get, as is required through the Stafford Act, those done. So, Jeff?
Yeah, this shortage of medical personnel, is this transient? Is this just COVID related, or is this something that we may be having to deal with longer term moving forward?
Yes. No, I mean, look, the reality is I'm advised that Mississippi hospitals have lost over 2,000 healthcare professionals within the last year. I think that there could potentially be an unlimited number of reasons. I think every one of those 2,000 made different decisions as to why they moved on. And so at this point, what I would submit to you is the reason they're 200 short. Well, look, I mean, I've been going back and looking. I mean, I can show you article after article that y'all have written in the last year and a half where some of these hospitals have laid off employees repeatedly, time and time again. And so, there are an untold number of factors, and what what each of those really aren't important right now. What's important is that we backfill those positions to make sure that everyone who gets ill, either with COVID or with some other illness, gets treated, and we're dedicated to that. Now, in terms of long term, I do think it's worth talking about. In terms of long term, one of the reasons that we are in the challenge we are in our healthcare system. I mean, the big reason is we've had a significant surge in COVID cases, obviously. But let's be realistic. There are a lot of days long before COVID ever occurred in which there are no ICU beds in the Jackson market. This is not unique to today. It's been exacerbated, clearly, because of the number of people who are coming in, but shortage of ICU capacity is a relatively normal thing, certainly in the Jackson market. And again, just to be clear, shortage of ICU capacity is less about facilities and a lot more about resources that are dedicated to the ICU. Yes, sir. What's your name, sir?
I'm Lee, Sanderlin, Clarion Ledger.
Okay, great, thanks. Thanks, Lee.
Governor, with cases just kind of continually climbing upwards the last couple of weeks, and now we've got patients in a hospital parking garage, do you feel like you could have done more the last 3 or 4 weeks, or been more present?
Well, I mean, obviously, again, another figment of the imagination of the press. Over the last 15 days, I've been available to the press 5 times. Thursday at Neshoba County Fair, last week in the Tupelo area, twice yesterday on the Mississippi Gulf Coast, and then today here in the Jackson market. And so the reality is we've been working very hard, doing exactly what I said I was going to do in March. In March, you'll recall I was very clear. My advice to Mississippians in March was to get your shot and live your life. And that's what we've been trying to do. And when you're governor, living your life is part of managing and maintaining a pretty significantly busy schedule, working very closely with our emergency management team. And I have the utmost confidence that we have done everything that we can to deal with the crisis that is before us, and we will continue to do exactly the same. Yes, sir.
Is there anything the state could do to have preventative measures to keep people out of the hospital and not have to rely on this federal aid?
Yeah, that's a good question. Well, look, sometimes y'all want to act like depending on the federal aid is a bad thing. That's actually the way the Stafford Act is set up. It is exactly the way the Stafford Act is set up. The difference here, of course, is, and that's one of the points, the only real federal aid that we're quote-unquote depending on that is not contingent of, or is not available in any and every natural disaster. If you go back to 1972, the most federal declared disasters Mississippi's ever had in any one year is 4. Since I've been governor, we've had 13. In all 13 of those disasters, we are afforded the opportunity to have federal assistance. It's just usually that federal assistance is at a 75% reimbursement rate. So the state has to usually pick up 12.5%, and the locals have to pick up 12.5%. Now, the difference, of course, is in most natural disasters, whether it's flooding on the Pearl River here in central Mississippi or hurricanes on the coast, is that typically Mississippi can draw from our other assets in other parts of the state. In other words, if we have a hurricane that hits the Mississippi Gulf Coast and we have hospital issues, well, we can work with North Mississippi Medical Center or other medical centers to put assets down there. Another example, if we have a hurricane on the coast and we have hospital issues, and just so you know, the reason we have Med 1, which is the facility that's being put up in the parking garage of UMMC, that is a State Department of Health asset, by the way. The reason we have that is because of Hurricane Katrina. In Hurricane Katrina, we actually went in and had to set up a remote hospital. Well, during Katrina or a hurricane that occurs on the coast, we could actually take assets from the Mississippi National Guard very easily. We could activate medical personnel, medics, etc., and we could activate them down to the coast. Well, we can't do this here during this particular crisis because if we did that, we would take individuals who were medical personnel in their everyday life. So they're getting up and they're going to work every day at North Mississippi Medical Center. We could activate them. We could force them to come be under our command, but we'd just be robbing from Peter to pay Paul at that point because we'd be taking our personnel from one part of the state and moving them to another part of the state when they really were needed there as well. So that's the reason that we find ourselves in the position that we find ourselves in. I will tell y'all, and this is, we'll see. I'm usually not in the business of making predictions, but my inclination is that the Delta variant is certainly started several weeks before it started in Mississippi. It started in Missouri and Arkansas, moved down to Louisiana, now is in Mississippi, Florida, Texas. My guess is there are going to be a number of other states that are dealing with this particular virus because it is so transmissible.
Governor, how many daily cases do you need to see before you consider a statewide mask?
I don't have any intention of issuing a statewide mask mandate.
Governor, I'm sorry, I'm gonna ask Dr. Dobbs about the mask, the issue of masks.
No, sure.
We heard Governor Reeves' position on wearing masks, especially if you're vaccinated. Now, the CDC says something different, and I think you endorsed their recommendations. From a scientific point of view, why should a person who's been vaccinated wear a mask? can't you be a carrier if you're vaccinated and not even get sick yourself?
Yeah, no, that's a great question. In general, though, we know that masks are very useful when used indoors, just to say in general, for preventing transmission. One of the challenges we've seen with masking is that most people catch it in circumstances where they wouldn't be wearing a mask. And so I think it's important for us to consider the other things around that. It's those indoor social gatherings. In the Neshoba County Fair, there were a lot of cases out in Neshoba, right? But it wasn't walking around outside without a mask on. It was 30 people crammed in a cabin, and you're not wearing a mask when you're asleep. So I think it's important, let's always remember the social context for transmission. So people should be careful about doing indoor social gatherings around other folks. Now, when we're talking about, why did CDC make the transition statement about the masks? Well, I'm going to tell you a story, and I think it's going to make sense. About 2 weeks ago, I tested a mom and her son. The son had lost taste and smell and been feeling bad for about a week, and he tested positive, as you can imagine. Well, the mom, who had been vaccinated, the kid wasn't vaccinated, the mom was vaccinated. I tested her, and she had one of the highest viral loads I've seen. Totally asymptomatic. Felt great. Called her the next day, felt great. Called her a week later, felt great. And so it's these asymptomatic carrier situation that makes us worry a little bit. I think it's important to think about, we always know that there's different targets of the benefit of the vaccine. The most important thing to do is keep you from dying, and we know that's working great. Number two is keep you out of the hospital and keep you from feeling bad. It's pretty good at that. For preventing symptomatic illness, it's about 88% effective, based on New England Journal studies. But if we look at preventing any sort of viral shedding, it's only going to be about 2/3 effective. So it's especially with Delta, and Delta has really high levels. I think if we think about our immune system instead of like a wall, it's more like a standing army. And what happens is you get attacked by the virus, and it's not like it's being repelled, it's getting in there, it's starting to do its thing, but your standing army wakes up and crushes it. So, but there could be a period of time when you could be contagious, and that's really the reason for having folks wear the mask. And I'm 52. I take a couple of medicines. I'm technically at some risk for COVID. For Delta, I feel pretty good about my chances, but I don't want it. I'm really scared. Hospital is plumb full, and I'm going to do everything I can to stay out of that hospital. I'm actually going to drive extra careful. I'm a pretty safe driver, but I'm going to be even more careful.
I have a good question for Dr. Dobbs, actually.
Governor, you good with that? Move on? Yes.
So,
Nick?
3 questions. Number 1, are we seeing significantly more transmission of coronavirus in the school setting this year compared to last year? Number 2, last year, was the controlled setting and masked environment of schools effective at preventing transmission in those schools? And number 3, if we apply the masking policies of last year to the school environment of this year, would we see less school closures and quarantined kids?
Yeah, so don't know about the first one. I mean, we're still kind of early in it. I mean, we didn't start school. We started school kind of on a downswing after the summer, so it's an apples and oranges sort of situation. We're starting school at sort of like the ramp up Delta, so it's a bigger challenge without a doubt, and Delta is certainly more contagious. We do know that kids in a structured setting with a mask on is the right thing to do to keep kids in school longer. That's why we've been working with schools, and I'm glad that a majority of schools have gone that pathway because it does make a difference. Duke University just put out an analysis looking at how effective it is, and they found that mask utilization. I've got to read the details more. I just saw it just for the first time today. That it's a good way to keep kids in school. So I do want to applaud the school leaders in the districts who have worked it out with their families and everything to get that across the finish line. We think it's a good idea. I think it's going to keep kids in schools, but the Delta situation is more challenging than we've seen before. Thanks.
Now, Governor, real quick follow-up. If the answer to that first question is yes, that because of Delta, transmission is significantly higher in the school environment in particular, would that make you consider a mask mandate just for schools?
Let me first address a couple things that Dr. Dobbs said. Dr. Dobbs and I have worked very closely together for the last year and a half, and I think I've told him every time we've ever met that it's okay to disagree with me. It's okay to not be exactly in line with me. And when it comes to vaccinated people wearing a mask, I do think that there may be some marginal incremental benefit. If the vaccine if it works, it works. And if it's 96, 97, 98% effective, or what it looks like in terms of hospitalizations, 99.934% effective, then maybe wearing a mask is a little bit better, right? if you go to your house today and you don't currently have COVID-19, if you go to your house today and you shut the door and lock it, and no one lives with you, and you don't come out for 2 years, you're probably not going to get the Delta variant of COVID-19. There are risks associated with functioning in life, and what each individual needs to determine and decide is what is the level of risk that they're willing to assume. Now, as it relates to kids in the classroom, I think the first question that you asked that Dr. Dobbs answered, it's way too early to tell. I think that's exactly right. I think it's way too early to tell. I do think that the Delta variant is more transmissible. It is more contagious, certainly in general. That seems very clear to me based upon the limited data that we have right now. And so we're going to continue to watch and monitor. And look, the one thing that I have said throughout this pandemic is if your question begins with, are you concerned with, it doesn't matter what comes after that, the answer is yes. And if the reality is, would you consider X, I will consider anything. But at this time, I have absolutely no intention of issuing a statewide mask mandate.
I just mean point blank, if there is more transmission.
I'm not gonna get into a hypothetical. I have no intention, based upon the data that I've seen, of issuing a statewide mask mandate in our schools. Now, if you have a kid that's 7 or 17 and you want them to wear a mask, by all means, I think you ought to let them wear a mask, and so I think that's great.
Governor, do you think there's any way to pull political strings to get some incentive programs going to encourage people to get the vaccine?
I'm y'all have written this a lot. I'm not really very good at pulling political strings. So, I'm not personally. I think that individuals ought to look at the data that exists out there and make the best decision for themselves and their families. I think that there is some. I think there's some legitimate concern that there is information out there that maybe some people are reading that is not accurate, and I think that does concern me a little bit. I think that it's really important, and that's why I often refer to individuals talking to their doctors, because I want them to get the best information available and accurate information, and that's why we're trying to do this.
And a question for Dr. Dobbs. Before we go into the weekend here, do you have any advice for Mississippians who might, either be on the edge or just concerned or anything?
You mean about the vaccine or just Delta variant?
Vaccine, Delta variant.
Yeah, so, there's so much misinformation out of here. I think in 100 years, they're going to look back at us like we looked back at 1918 flu, and they're going to be, oh my gosh, what a colossal failure that was in public communications because we allowed the disinformation to drown out the reality. Let me just be very clear, the vaccine is super safe. We have confirmed 7,500 deaths plus from COVID and 0 from the vaccine, right? We've had, what we've had so far, we've had 4 cases of myocarditis that were mild, and all of them got better. They were young adults. Myocarditis is far more common with COVID itself. COVID is way worse than you could ever have with the vaccine from what we've been looking at. And even the rare things we saw with Johnson & Johnson, I think that's a validation of our monitoring scheme, that even these rare things, we're able to detect them. But as far as just being safe, Delta's not going to last forever. I'll just tell you what I do. I'm vaccinated. I wear a mask in public. I'm avoiding indoor social gatherings. Pretty much all my friends are vaccinated. If we hang out outside, on the front porch sort of situation. If I were in D.C., I'd probably love to go to a ball game. But I do it outdoors, right? But I'm not going to go to a bar, and I'm not going to sit around with other people breathing indoor air. I think there's a way to be safe, but there's also a way to do stuff. I think the phase that we're in now is the phase of doing things safely, even though it's Delta, the phase of doing things safely. But I think it's critical of those elements is to be immune, masked in public, and just use some common sense.
I have a question for Dr. Dobbs. Dr. Dobbs, do you agree that most children with COVID end up with a bad case of the sniffles?
Yeah, most kids who get COVID do fine. I mean, they do fine. We know that the risk of long COVID for kid is only about 5%. So it's better than it is for grown-ups. I think the real challenge is our tolerance for children is so much lower as it should be. We know that the mortality rate for kids is about 2 per 100,000 cases. And so if you lose your kid, I mean, most kids are going to be fine. It's just going to happen. But there are bad things that can happen, and for that one family, it's 100% of a tragedy. So we really want for people to know the risks, especially for teenagers. I just want to reiterate, there are zero concerns about infertility. And then I was communicating with a representative today. I sent him a ream of information about there's no female infertility issues. Actually, COVID is very damaging to women's reproductive health, increases preeclampsia, preterm birth,